focus. A new COVID-19 variant has been detected. C.1.2 is raising concerns over its ability to mutate. But some scientists say available vaccines are effective. Let's find out more from vaccinologist, that's Professor Shabir Madhi, who joins us now for some insights into this story. So, Prof, at this point, what do we know about this variant that seems to be going against the grain in as far as the agreed naming convention, in that we're now doing the Greek letters of the alphabet, but this one is known at this point as C.1.2. What do we know about it?
So good morning. So thanks for having me. So the reason it hasn't been given one of those Greek letter alphabet nomenclature at the moment is because it's still under review by WHO and others before it actually goes through that process. And very soon it probably will have some Greek alphabet attached to it. What we do know about this variant, and the reason why it is of concern, is that it sort of seems to be a combination of the Delta and a Beta variant. The Beta variant, as we know, the big problem with the Beta variant was that the variant has become somewhat less susceptible to the antibody activity that's induced by past infection, as well as antibody activity that is induced by many of the vaccines. And with the Delta variant, as we know, the big concern there is that it's a much more transmissible variant. So this particular variant has got mutations which could potentially make it less susceptible to antibody activity induced by vaccines, as well as more transmissible. But that does not mean that vaccines won't work. And I think we need to be clear about that. Even for the Beta variant as an example, despite that variant being less susceptible to the antibody activity of the AstraZeneca vaccine as an example, and it didn't protect against mild disease and infection, the AstraZeneca vaccine still protected against severe disease. So it really depends what our expectations of vaccines are. If we're wanting vaccines to protect against infection and mild disease, unfortunately, not many of the vaccines that are currently licensed work very well in protecting against infection and mild disease. For the Delta variant, as an example, the Pfizer vaccine, which is one of the best vaccines in protecting against infection and mild disease, only reduces your risk by about 50%. But over time, that 50% reduction also can be extremely important from a public health perspective. But all of these vaccines, the type of mutations that are taking place in the virus, which is mainly affecting the spike protein, the parts of the spike protein that are being affected by these mutations are not affecting what we call the T cell responses. It's a different arm of the immune system, which also which basically confers a protection against severe disease. That part of the immune system and its ability of vaccines to stimulate that part of the immune system, and ability of the person still to resist severe disease and death, that remains largely intact. So it really depends on what we're trying to achieve when we do vaccinate people. And the primary focus has to be prevention of severe disease or minimizing severe disease and death from COVID.
So which attitude do you take, Prof? And I suppose by extension, I would say those who are, seeking counsel from people such as yourself, what attitude should we take? Should we take the attitude that says, from the reports we are getting now, this was first detected around May, and yet it has not become a dominant variant in our communities by August. And therefore, we should be concerned because it's a new variant, but we shouldn't be alarmed that it will take us in a different path in as far as the spread is concerned? Or should we be saying that actually this variant should worry us because it seems to be taking the best of the Beta variant and the Delta variant?
Yeah, so we obviously need to keep an eye on the variant, but I wouldn't be overtly concerned at this point in time. The Delta variant seems to be much more efficient in transmitting and actually entrenching itself, not just in South Africa, but many other countries as well. And whether this relatively new variant would outcompete the Delta variant, I think extremely unlikely, given what we've seen over the past 3 months. And as you mentioned, indications are that this variant has been around in South Africa since June already. And over that period of time is when the Delta variant very much arrived in the country and pretty much started to dominate and now makes up more than 95% of all infections that are taking place. So we need to keep an eye on it. But I think the most important thing from a public health perspective and from an individual level is that we still expect vaccines to protect against severe disease, even due to the C.1.2 variant. So I wouldn't be too concerned right now. Unfortunately, it might well be that the vaccines might protect less well against infection and mild disease. But right now, the tools that we've got available to us are primarily meant to be trying to assist us in reducing the burden of severe disease and death.
Yeah. So just before I let you go, Prof, accepting that professionals such as yourself, you don't go out to seek to make exact predictions of the trajectory of the pandemic, but it's more projections based on the data that you are studying. There's talk of a fourth wave possibly hitting our shores by late November, beginning of December. When you think about that possibility and you weigh it up against the race to get jabs in arms, what comes to your mind?
Yeah, so given what has transpired in South Africa, including a high force of past infection, as well as the increased penetration of COVID-19 vaccines, there will likely be a resurgence taking place in November, December. It might differ across the different provinces as we observe in a third wave. But with everything that has happened up until now, and especially what the estimates are, is that 70% of people might well have been infected during the course of the first 3 waves. And that natural infection does confer protection or reduce the risk of developing severe disease subsequently. So should we experience a resurgence, the number of people that end up in hospital, the number of deaths that would occur are unlikely to be anything close to what we observed during the course of the current resurgence, and probably even less than what we observed during the course of the first wave. So the next resurgence is not going to see the large number of hospitalizations and deaths that we've experienced up to now with each of the first 3 waves.
All right, I've got to thank you for your time and your insights there. That's Professor Shabir Madhi. He is a vaccinologist just talking to us about the C.1.2, the new variant. And I won't even try to interpret what he was saying. The point of it all is that we bring these experts to you so that you hear firsthand and you make up your own mind. You're watching All Angles on eNCA.